Okay, let me bring up Dr. Israel. That protects you. They are responsible for protecting you, defending you against foreign body, against anything that will cause you problem. Shey they hear so? Make I bring up Dr. Israel. Dr. Israel, good evening. How you there?
Good evening. Happy Sunday to everybody.
Yeah, happy Sunday to you. Welcome, welcome. How family now?
I do, Dr. Fred. Welcome to your former place of seat.
Yes, so okay, so Dr. Israel, before you come, I be they ask everybody, make them tell us what they understand by immune system. So Bello says it is the ability of the body system to fight against disease. Grace Monday says is the part of our body that protects us. Isata Mendy says is how your body responds to everything. And then Izu says immune system is part of your body that defends you against sicknesses. So, Dr. Israel, I make a hand over to you.
Okay. Everything when they talk, then they correct in one way or the other. Yeah, they correct. We not go feel remove take that one away from them. So it means say then they have idea. They know what the immune system be. So immune system now that part of is a system when they help us dey fight against infection, fight against diseases, fight against bacteria, or fight against any foreign body, anything when the body look as foreign body.
Yeah.
And the immune system now dey help us dey fight against them. And the immune system is just the white blood cell. The white blood cell for the body now form the immune system. And now they form the immune system. So they help us to fight against anything when not supposed dey the body. As they pass through the bloodstream, as they pass through the artery, the vein, as they pass through all those sides, they watch and they check the every part of the body to see if there are anything when not supposed dey the body, and any of the things when they see when not supposed dey the body, they go quickly catch those things and try to see how they go fit save the body from those things.
Hmm.
Yeah, that's just a brief explanation or a brief description of wetin immune system be. Yeah, there are different type of immune system. There are different type of cells wey dey help us do this work. And there are different type of cells for the body, white blood cells for the body when dey help us do this work. But that will not be wetin we dey talk about. For today, we go just group all of them as immune system. So everything wey we dey talk about, we go dey talk about immune system as a whole, because na almost the same work na dem dey do. All the important thing is that their work na to just protect us. So whether they protect us through left or they protect us through right or they protect us through middle, that are not dey important for today. The thing that is important is that they protect us. That's what is important for today. Okay, Dr.
Hmm.
Fred.
Yes, yes. Thank you very much. I like the fact say you talk say the major thing be say that they protect us, because some people think say immune system na small thing. Immune system is very big, and we are not here to start telling you all the different types of immune system because you go run come out. You understand? But majorly we want me you know say the job of immune system now to protect us. But right now, why is it that everybody come dey talk immune system, immune system, immune system, immune system, and I want to boost my immune system? Before we talk about how to boost your immune system, I think it's important we talk about wetin be those things where they make some people get low immune system, wetin be those things where they affect your immune system, wetin be those things where they make your immune system no fit work well as an individual, whether you be man, you be woman, you be papa, you be mama, you be young, you be old. You get some kind of things where you go do, those things go make your immune system no fit function properly. And that one I want make you know before we start talking about other things about the immune system. Sure you understand that, because when you hear the word system, system means say plenty things dey inside. System, immune system means say you get different soldiers, different part of your body, wey dey responsible to protect you. No be just one thing like that. There are plenty. But let's talk about some of the things wey fit affect your immune system. Make I start. Now, very commonly in our generation right now, everybody they work, everybody they hustle, everybody they find money, and a lot of people know they sleep, a lot of people know they eat well. Now stress now one major factor where they bring down the immune system of people. So stress now one thing where they affect a lot of people immune system, and this is why you should take notes to find out you yourself, am I stressed? Because if you dey stressed, true, that stress go touch your immune system. So make I hand over to Dr. Israel, make it continue again.
Okay, and for the things when they actually they help when they reduce when they cause low immune system, I go want to divide them into different group. We will divide them into disease, medication, and our lifestyles. So I think now me just divide them like that. So, okay, with that, I think I'll be able to talk many things inside them. Now, for the
Yes.
lifestyle, Dr. Fred already talked one, which is stress. So stress
Yes.
is one thing when they help to reduce our white blood cell, our immune system, because with stress, they make the immune system not they fit do their function, and they reduce their power, and
Mm-hmm.
every other things go come up. So another
Yes.
thing when we dey do wey go fit wey still dey cause low immune system na the rate wey we dey consume alcohol. So when we say alcohol disorder, alcohol usage disorder, so people wey dey always dey drink alcohol, this alcohol go fit still reduce the immune system, because when the person don drink, e dey give every organ so many work to do, and when they don dey do this work, you don stress the organs, you don stress the body, e go still lead to reduce immune system. Another one na smoking. So those wey dey smoke well, you dey cause you dey give every part of your body a lot of problem. The lungs, you dey destroy the lungs, the skin, you dey destroy am. In fact, we find out say anything when we dey talk about, anytime we dey talk about cancer, one risk factor when we know dey comot na be smoking. So even in this reduce immune system, smoking still dey e still join wetin dey reduce our immune system. And another one na lack of sleep, insomnia. People wey no dey sleep for one reason or the other, whether na you by yourself generate that insomnia, wey be say in the night, instead of you to sleep, you carry your phone, you press from that night till the next morning, or you dey watch TV from that night till the next morning. Anything wey no make you sleep, wey no make you get the normal amount of sleep, can also reduce your immune system. You know, say we say at least sleep for 8 hours. So if you not sleep for at least 8 hours, it means say, yeah, you dey reduce your immune system. So those are things wey we dey use our hand dey do, activities wey we dey do wey fit cause low immune system. Then for the disease states, when we fit cause immune system, these are things wey dey reduce our immune system. One, diabetes go reduce the immune system. Hypertension go reduce the immune system. People wey get HIV/AIDS, their immune system go reduce, because HIV/AIDS dey reduce immune system. Cancers go reduce immune system. Now there are some disease wey be they are genetic related. They are genetic related, like rheumatoid arthritis, lupus and rheumatoid arthritis, and all that. Even one blood disease, any blood disease, any blood disease, yes. All these ones now some disease states when go fit help reduce our immune system. Then when we come talk about medication, there are some medication when people they take when they reduce the immune system. And one of the medication when they reduce the immune system well now steroid. People where they consume steroid for any reason, when you say you want fat, or you want do this one or that one, that this and this, you they consume steroid. So you they also reduce your immune system, because what be the function of steroid? The function of steroid now to make sure say the immune system not over exaggerate anything. For us with the sneeze, now the immune for sneezing are just an immune response. say dirty don full your lungs, so you sneeze so that make those dirty comot. But because some people when they sneeze, you'll be like say, man, everything, the world wan end. So we give all this antihistamine, all this drug to reduce the immune system, make the immune system calm down, may not too exaggerate it. So if you come dey take that steroid, it means say you don dey suppress the immune system. And when you suppress the immune system, it means say you don reduce the immune system already. Then another medication, those wey do transplant, so in a disease state, transplant, any transplant, all these people go dey on medication when they reduce immune system. Why? So that make that their body fit accept whatever was transplanted into them. Kidney transplant, liver any transplant, whatever was transplanted into them, they need to dey on some medication to dey reduce their immune system. So all those kind of people go still dey prone to, and they go still get low immune system. Those wey get medication when they use to treat cancer as well, all those medication go still reduce immune system. So if you notice, I have mentioned a lot of things, and with make I just do small recall of wetin I mentioned. But when I do this small recall, I may not mention everything as I first mention am. And so we talk about stress, we talk about drinking, taking of too much alcohol, we talk about smoking, we talk about person not dey sleep, we talk about diseases such as diabetes, HIV, we talk about genetic diseases such as rheumatoid or lupus arthritis. Then we can talk about medication, use of steroid, cancer drug for treatment of cancer, drug to reduce the immune system when person do transplant. So these are some few things when I go fit mention for now when go reduce our immune system. Dr. Fred.
Dr. Israel, thank you very, very much. If you just dey watch us, we dey talk about the immune system because you ask us, say we'll talk about them. So we dey do live video today, live session. And Dr. Israel don't break a lot of things. No forget, as we dey discuss, if you get any question concerning this immune system where you want ask us, we will take your questions. So just relax. We still get some more time. But before I continue, I want to appreciate somebody who send us stars. Orobosa, thank you for the stars where you send. Our people, they know they like share this live session. Why you know they share? Why you know they like? Share, make more people come watch. Like, make people watch. If you send us stars, send. Thank you very much. Now, we know the things that can affect our immune system. Listen carefully. If there are anything where you they do, where they affect your immune system, the simple answer for you now to stop that thing where you they do to help your immune system. Because we don't hear a lot of people go, they ask us, I beg go, what can I take for my immune system? Whereas now you be the main thing where they even damage your immune system. So there is nothing you will actually take to correct if you know stop those bad things where Dr. Israel mentioned, the ones will be your lifestyle. So let's talk about some of the signs of a low immune system, which you go see for person body if the immune system is low. Let me just give a brief breakdown. Sometimes when the immune system is low, the symptom where you go give you might not be able to even know say na low immune system because you understand? Because I remember Dr. Israel mentioned things like infection, viral infection, fit bring down the immune system. Things like diabetes fit bring down the immune system. Even things like malnutrition, especially for people where they severely deficient in nutrients. The kind of food where you they chop, you know, get all those necessary nutrients for your body no go fit dey functioning very, very well. These are some of the things. Now, what will be the sign of a low immune system? The sign of a low immune system, I go start again, I go still hand over to Dr. Israel again. It can be non-specific first. Non-specific means say if he give you any sign, even body pain, just body pains could be a sign of a low immune system. Do you understand? And then we might now have specific signs depending on some kind of condition where they cause them. But before I hand over to Dr. Israel, everybody help us share this live session. Click on the share button. Share, make people come watch. Thank you. Dr. Israel, over to you.
Okay, yeah. Before I dive into that the signs and symptoms of a low immune system, one thing day when I not talk, as Dr. Fred talk malnutrition, it just remind me eating too much junk food. And when you dey take too much of junk food,
Mm,
e go still fit reduce your immune system, because when you take a lot of junk food, you no go give room for your body to get a lot of all those nutrients when you need, wey suppose improve your immune system. So those people wey are very good at eating junk food, everything you wan eat from morning till night na junk food, you no dey help yourself at all. You no dey help yourself at all. Okay, so those ones na wetin I go talk for that. As Dr. Fred say, abeg una try abeg try. You wey dey lis ten to us, so abeg try share this video so that others go come join, because this topic many people really need to know, and as you don know, make you let other person know as well. So the signs and symptoms. So some of the symptoms and is just like as Dr.
okay.
Fred talk.
Can you hear me?
Yes, I can hear you.
Okay. Continue, I beg. No verse. My network been go bad. Continue.
Okay. Now, okay, some of these signs and symptoms are normally you fit fall sick at any time. Yeah. And every sickness get their own routine, their own like how long they suppose last. So when you come fall sick, you can't be say the sickness going to take a longer time. So it shows say one, your immune system they low. Another one, if you they always they tired, you never do anything, you don't tire, you are always tired. It means say your immune system they low. You can't get injury for body, the injury not green heal on time. Because now the immune system also get role when they play in wound healing. So when your system not green heal on time, you also know say yes, you get problem with your immune system. Now another thing is I don't mention three. Okay, I think I don't forget what I want to talk.
Uh-huh.
It be many for my head. I don't forget. I
Which
dey
one
come
you
out.
mentioned? Which one you mentioned?
If
My network went bad.
okay, the one I mentioned, one is if your sickness. Okay, I don't remember. Another one I be say your body will come to get some kind of disease when not supposed on disease when not supposed catch you.
Mm.
Your body will come you come to catch am, and all those diseases that what they call opportunistic infection. And so this opportunistic infection can be virus, can be bacteria caused, and all that. So such as people come to get tuberculosis. Yeah, your body supposed to handle some amount of the bacteria where they cause tuberculosis. But when your immune system can't come down, that bacteria when your body don't handle before, fit can cause problem. So tuberculosis fit can even come due to reduced immune system. So those are part of opportunistic infection when fit come. And also, as I say, person go dey tired easily. Person go dey go fall sick, the sickness not go quick heal. Another one, you fit get injury, that injury not go green, e no go green heal. Another one, you come dey get opportunistic infections when not supposed catch you, when your body supposed to take care of, go come dey affect the person. And another thing I be say, this person will fit come dey fall sick almost every time. Almost every time. It's something where be say maybe now once a year you dey fall sick before. You can't notice say every month, every week self you dey fall sick. You go know say yes, your immune system dey low. So these are now the ones when I go fit mention for the meantime. Except Dr. Fred get others where you want talk.
Yeah, thank you so much, Dr. Israel. Some other symptom be say the person say if they lose weight, um, as a sign of a low immune system, if they lose weight, which we call unexplained weight loss. Sometimes the person if they pass watery stool, water, if they shit water, which they call diarrhea, chronic diarrhea. As part of what Dr. Israel mentioned, if they get joint pains, you understand. These are some signs of a low immune system. Now, one thing where we want me, you know, be say, no be say because we mention, say somebody gets all this kind of thing, say you go take this kind thing
Dr. Fred.
for how far you dey hear me now?
Yeah, they hear you.
Okay. No be say because we talk about this thing now, you don't talk, say your immune system is low. I have a low immune system. No. There are many things that can give somebody unexplained weight loss. You hear me so? Person if they get rash for body, some other things fit cause them. Somebody if they get the lymph nodes, they call lymph nodes, all those kind of things where they for like armpit area, those things fit they enlarged, enlarged lymph nodes. Many things too they will fit cause them. So if you notice, say you get some of these symptoms, we no talk say when you can't dey cry, say you get a low immune system. If they follow us, I'll be very good. Now let's go to the other part. Okay, what be those little things where you feel do, where feel help your immune system, where feel support your immune system. Remember, if you dey watch us for the first time, for here we know they diagnose anybody, we know they treat online. Here no be hospital. We are just here to teach you. So what be those little things where we feel do, where you feel do at home, if you also help your immune system. May we talk about them. And then if you get questions for us, start dropping your questions so that after we don't talk these ones, then we will come take your questions on the immune system. Dr. Israel, over to you.
Okay, well, what we go fit do to improve our immune system? You know, we don't mention things when it cause low immune system. So anything when you go do, mostly for the lifestyle part, for the lifestyle part, you need to change your lifestyle. So for those way they drink different brand a day, you don't take like 5 different brand. We will advise say make you reduce your drinking. Another one, the most important one, are reduce stress. You know, say this part of this world as a whole is full of stressful activities. From when you wake up from sleep to when you come back, go sleep again, you can just be stressed. So look for any way to reduce your stress. And one of the few things you can do to reduce stress, if you notice say your area don dey heated, taking a simple deep breath is a way of reducing stress. It's a way of reducing stress. Taking a little stroll, you dey do something and your head dey hot, everything. Stand up, take a little walk, take a break. That's why even for work sef, I don't know, for most companies, most work, they get break time. So those are just to make sure say we help to reduce our stress. Exercise is also very, very important. Exercise is very, very important. As exercise go fit help us reduce diabetes, go fit help us regulate our BP, it go still help us reduce our stressful nature. So exercise is also very important. When you take, not be when we say exercise, it not mean say you must go carry weight. No, there are simple exercise you can do that can also help to reduce stress. So these are just some few things you fit do. Then eating balanced diet is also very important. Reduce your junk food, but eat a lot of balanced diet. Balanced diet that contain vegetables, that contain fruits, that your water, and those are very, very, very important. Another thing, now take a lot of, we don't talk water, take a lot of water. Water can also help. Water can also help. For those when they smoke, try stop smoking. Stop smoking or reduce down to the barest minimum, so that make you not come get problems. Sometimes we even say for those when they even smoke, you can also be taking vitamin C. That's just because now anti what do they call it? Antioxidant. So it can also help to remove some of all these things when they cause problem for the body. So take a lot of fruits, take a lot of water, vegetable. And for any reason when you know they sleep, for us when they by ourselves cause that insomnia, all those things when you take they cause your insomnia, reduce them so that you can actually be able to sleep. And also if you do exercise, a good exercise, it can also improve your sleeping. So when you are able to have a good rest, it will also improve your immune system. So you can see, say everything when I don't mention, there's no place I never talk about medication. Say, you need to go and take this medication. Now this medication I go boost your immune system. No, because all those medications, what that they do, now just what your fruit, your vegetable, they do. And so when you eat a lot of different fruits, there are different fruits. You take a lot of them and they contain so many things. All these fruits contain so many things, so many different things. So recently I just learned about this sweet melon and all the importance of the sweet melon. I was surprised. What? So eating all of this sweet melon can give me a lot of and help me to fight a lot of diseases. So it was amazing. So when you take a lot of fruits and take a lot of vegetable, drink a lot of water, rest very well, you would have helped to fight most of this infection. Then if you are taking some medication for no cause, for no just cause, it's also very good you reduce or you stop those medication, except these are medication when you say your doctor now prescribe them for you. So even when your doctor prescribe all those medication for you, you need to take all these vegetable, fruit and all that, and to cover up the immune system to some extent. And if you are diabetic, we talk and say diabetics can reduce the immune system, but when the sugar is well controlled, the sugar is well controlled, your immune system will see the normal. So take your diabetic medication very well so that your immune system can still be normal. So I think these are so many things that you can use to improve your immune system. Yes, we cannot talk about this without saying some medication, supplements. And so there are some supplements that you can also use to boost your immune system. This is after you have taken all what we have said, when you don't take all those many things and it's still not there enough. That's why they call them supplements. So they are not taking the place of your normal food. They are not taking the place of your normal fruits. They are not taking the place of your normal vegetable. They are not taking the place of your normal water. No, they are adding to it. So when you take all those things and you take that supplement, it means that you are boosting it more than it should be. So these are things when we go use to boost our immune system. Dr. Fred, over to you.
Thank you so much, Dr. Israel. Now I like the fact say we don't list some things wey fit help you boost your immune system without mentioning any medicine. We no talk say medicine no dey o. For some special cases, yes, medicine dey. But these ones now, wetin you go do wey be say go help everybody first. Now, if you get questions for us about the immune system, anything you want ask us, we go take them down for you. But please take notes. You get some kind of people will be say their immune system they very, very bad. They very low. Those ones, when they enter hospital, after they don't check them, those ones, if you give them so many medicines to help them. But not be saying you go just wake up and immediately you define medicine for your immune system, because you feel go take medicine where you no need and you go just waste money. You understand? Now, let's see if you hear us right now. Ask us your questions in the comment section so that we will take them. Now we get one question here. The person they ask us, Dr. Israel, because we mentioned about stress, we talk about stress. You say, how can we stop stress? What we fit do? A lot of people they go through stress every day. What can we do to stop stress, Dr. Israel?
Okay, we not go fit stop stress, but you go fit reduce stress. So those are two different words. Stopping stress and reducing stress now two different things. So you not go fit stop stress, but you can reduce stress. And I think I said some few ways when you fit reduce stress. Common, taking a deep breath is a way to reduce stress. Exercise is a way to reduce stress. And when you don't do exercise, there's every tendency to say you go sleep well. Those are ways to reduce stress. Taking a stroll, when you do something, your head is hot, get up, leave that thing for that moment, take a stroll. is a way to reduce stress. So these are ways to reduce stress. But in our life, stress don't become part of us. Now something when job like saying a normal thing nowadays, but you can always reduce it. You can always reduce it. So with these few things when I mentioned, these are few ways you can reduce stress. There's a model for stress management. Eh? There's a full topic for stress management. So when you are able to get hold of that, you feel read down and see many things, many other things when person fit do to reduce stress.
Thank you very much, Dr. Israel. Now we dey take questions, but our people, you know they share this live session, and they tire me for you. You know they share, you know they support. Ha! Now wow, no problem. Okay, let's go to the next one. My question is for those of us that only sleep for 5 hours, does that mean we are not sleeping accordingly? Okay, make I try answer first because I did what we call like a systematic review or literature review on sleep some months back.
Dr. Fred.
Give a range 6 to 8 hours of sleep. Some people go need 8 hours, some people 7 hours, some 6 hours. But one very important thing they said about sleep: if when you sleep you can't wake up, you can't notice say you still need to sleep, you dey feel dizzy, it means say your body never even get enough sleep. That is number one. And then if you dey sleep 5 hours, most likely you know they give your body enough sleep. Because it get how you go down dey sleep 5 hours, your body go come dey adjusted to that time. Not meaning that now you need oh, but because you don't train your body over the months, weeks, the body don't come dey adjusted to this time. And then you go see say e dey normal. So basically, about 6 to 8 hours of sleep. It's difficult to get 8 hours as stretch for this present day time. But what would they tell people? We say you need to prioritize your sleep and plan accordingly because now you go suffer out. Okay, Israel, over to you.
Okay, I think you answered the question. So, and studies have shown say 6 to 8 hours of sleep. That's the normal length. So six, if you sleep six, if you sleep seven, if you sleep eight, and if you don't feel sleep rich like that, it should say you have slept. So for those when they sleep 5 hours, you just have 1 more hour to complete your your sleep, the normal sleep ratio. So what you feel do is that see the time when you take they go to bed. And I know say mostly for those of us when they Lagos, sometimes we they wake up on time. So if you know say you be kind of people when they wake up on time, try to go to bed on time and try to sleep on time. I know say some people go see talk say before they come back from work, before they do this, do that, do this, they do over time over go and all that. But I think we can still look for a way to manage to do that so that you get home on time, you sleep so that before the time when you want to wake up reach, you have slept your 6 hours. So you'll be able to then you'll notice that when you sleep completely, you look refreshed. You yourself go notice, you will not be tired. So when you sleep, wake up in the morning and you are so tired, weak, my guy, you have not slept. You have not really slept, or sometimes you have overslept, or sometimes you have overslept. And so it is better that when you wake up in the morning, you are active, you are agile, you are ready to go. That's when you know that you have complete your routine.
Thank you so much, Dr. Israel. Yeah, we dey talk about understanding low immune system. In case you just dey watch us, in case you just dey join right now, you're going to go from the beginning, make you understand a lot of things. So we dey take questions right now. Don't forget, if you want to sponsor this live session, you want to sponsor this program, you want to place an advert on any platform where I get, you can send an email. Very, very interesting because we go relate with you. Okay, now more take more questions, Dr. Israel. The person says, is having regular cold a sign of low immune system? Thanks for the good work. Dr. Israel, please respond.
Yeah, the answer is yes. When you're having a lot of cold, um, normally somebody having common cold, it should last for most of the time 7 to 10 days. And studies have shown that a normal healthy human being can have common cold at least 3 times in a year. So, but you can't get an often and often and often. It can just be a sign of low immune system. And that on one hand. And another thing, it can also be a sign of you have allergic reaction. So now two different things. But most of the time, it's actually a sign of low immune system.
Yes, could be a sign of a low immune system. So we have a question here from Grace. It says, what kind of fruit is really good for immune booster? What kind of fruits? What are the fruits that can boost my immune system?
Every fruit you take can boost your immune system. Every kind of fruit, except the one you are reacting to. That will cause problem for you. But every fruit, every kind of fruit boosts the immune system, gives you one or two things. Watermelon, mango, orange. In fact, as the season come, you eat it as they come. So they join to boost the immune system. And they are all good. Every kind of fruit.
Yes, they are all good. So it's the one where you see, except your body no like them. Okay, let's see if we have any question here. Um, Okudili, I'm sorry, we cannot take your question. Okudili, you just they ask us question what we don't talk about, so you go need to go back and watch from the beginning. How do I know my immune system is low? We don't talk about Okay, good evening. Doctors, can oversleep affect your immune system like 10 hours at stretch? Okay.
Okay, remember when I talked something about when you sleep, you feel wake up very tired? Is showing two things. And one, maybe you have not completed your sleep, or two, you have overslept. So when with anything when you overdo can actually cause problem for person body. So too much of everything is bad. So when you oversleep 10 hours, it will also help to reduce your immune system, because you are not giving that's not the normal amount of sleep the body needs. And so when you sleep the normal amount, you get up, your body is agile. But when you oversleep, and you are also weakening the body systems. And when you weaken the body system, it can also be a way when infection go quick enter person body. So yes, it can also be a sign of a way to reduce your immune system.
Yeah,
So try
thank
and
you.
sleep your normal amount.
Okay, I like this question. But doesn't some fruits contain sugar? Let me answer this question. I like this question very well, and I want you to listen carefully, because a lot of people don't tell you, say, fruits get sugar, fruits are bad, and this. Please listen to me carefully. The sugar in fruits are very healthy. Spell the healthy in capital letter. Very, very healthy sugars. The sugar in fruits, your body go take time, gradually break them down, absorb them. These sugar are healthy. They are natural sugars in fruits. The sugar wey dem dey shout for una, wey you dey talk about, na the sugar in your soft drinks, the sugar in your junk foods. Those ones are unhealthy. But you see your fruits, the sugar in your fruits are extremely healthy for you to eat. But if you get a medical condition, let's say you have a problem with your blood sugar, even at that, that does not mean you can't even eat fruits. You eat fruit in moderation. You monitor how you eat the fruits, because it is still good for you. Because you get diabetes no mean say you no fit chop fruits. Because I see a lot of people on the internet, they go tell you say sugar dey fruit, oh, no chop fruit, oh, it is bad for you. take your shoe and run away from that fellow, because the sugar in your fruits are extremely healthy. It will give your body what you need. Your body go absorb them gradually at the right amount. It no go give you problem. So eat fruits, they are healthy. But the sugar that we want you to run away from, artificial sugars, refined sugars, sugars in your soft drinks, sugars in your alcohol, sugars in your junk food, and all those stuffs. Now, those ones bad for you. Make you not touch them. Is that okay? I don't know if Dr. Israel has anything to add.
Okay, I don't think I have anything to say. And no, nothing to add. So just say the sugar for our fruits, they are natural. So say they'll say natural thing, they're very important. They are not synthetic, nobody manufacture them. So we say run from manufacturer sugar, manufactured sugar, but your natural sugar, they are good, to go. And that's what your fruits contain. And even though they say not eat some fruit, maybe you get diabetic, not eat some fruit. Not be all fruits. There are still some fruits you can eat,
Yes.
even as a diabetic patient. Even though your doctor say don't, your doctor can never say don't eat. Even though they want to tell you fruit, you go mention the name of the fruit when you not go eat. So it doesn't mean that there's no fruit for you to eat. There's always a fruit.
Yes, there's always a fruit. You don't hear. Okay. No more questions for us. Okay, Dr. Hem. How often can one eat fruits? Let me answer again, because and you know now, for those of us who they follow us, they come since we talk about our 1 month fruit challenge. Listen, according to the World Health Organization, every individual should eat at least 1 fruit a day. 1 serving of fruit a day. But the problem is that some of us, we know if we afford them. It is difficult for us. Every individual supposed to eat at least 1 serving of fruit in a day. Not be say I chop fruit on Monday, I go travel. You're not eating fruit. It should be a part of your life. It should be a part of your diet, a part of your food. That is how you should eat fruit. And so not allow anybody make you panic and tell you that you should not eat fruit. Fruit are bad. No, they are very good for you. Dr. Israel.
Yeah, you are good to go. Fruits is, you eat fruit every day. When you get the resources or you get the fruit for your house, why not eat it every day? But now me say me carry 20 fruit. Now me say me carry 20 fruit over once and eat all of them because we say eat fruit every day.
Yeah, so okay. Any more question? Any more question? Oh yeah, I'll ask us now. Let's see. You are right. My doctor has never asked me to stop eating any fruit, but these social media pundits are putting ban on almost all the sweet fruits for us.
That's why you're not supposed to follow all those. Somebody came to meet me in my office one day and he said, then say, and I asked, who say? I said, because when you hear then say, and you don't know who said it, you need to verify the information. And you yourself, you day still social media, you can press your phone, Google is your friend. So when people talk so many things and you don't understand that, check it out. Find out if not true. And another best person that can actually tell you the truth is your doctor. If you really get good doctor, when you they follow, when they treat you, your family, in fact, your family doctor, when know you well, most family doctors will not go want to tell their patients the wrong thing, except those they will not want to tell their patient the wrong thing. So when you hear anything that is strange, ask your family doctor, now truth or not lie. So it go be the best person to tell you if not truth or not lie. So somebody asked me again, say, I hear say for HIV treatment, injection don't dey. Now I ask and say, why you not ask the person where he dey? He can't quiet. I say, yes, now you will ask. The next question you will ask is where he dey, so that make you know whether it don't reach your country, Nigeria, or not. So if you never reach your country, Nigeria, you don't need to be thinking about it that you get it like tomorrow or next tomorrow. So you should be using what you have on ground. So every information when you hear, please verify it and verify it. So most of those social media people, I don't know. I don't know what to say about them, but we just need to be careful. Be careful of who you listen to, and even when you listen to them, please and please verify their information. Even when we they talk, so verify our information if we are lying to you or not.
Mm-hmm,
Eh?
mm-hmm,
You
mm-hmm,
go, yes, say
mm-hmm.
sometimes Dr. Fred or I we talk something sometimes. We'll come back after maybe after some sessions and say, oh, there was a session we mentioned so. That information is not fully correct. We'll not tell you the correct information. What did that one tell you? It tell you, say, even we they go see do research, we they read to make sure say we not tell on our lie. And so even our own information, what would they give you? Verify them. And if you still notice, say there are some questions you will ask us, we not know, we go tell and say we not know. Say we will check it out.
Mm-hmm.
Because we not be author of knowledge, not be
Mm-hmm.
we starter, and not be we go ender. So please, every information you get, I beg, my take home for now today is verify every information that you get.
Yeah, thank you so much, Dr. Israel. This is very important. Very important. Is it advisable? So let's try to be very fast. Okay, I can eat cucumber today, tomorrow, and watermelon next tomorrow. Sure, you can. Is it advisable to eat any fruit that comes out in a season? As long as you can eat it, you will not react to that fruit. Your body no go reject them. You understand? You have no problem. Go ahead, eat the fruits. You understand? Like let's say mango is in season. Eat mango if you don't have any problem. Because when mango disappear, you might not find it to eat. Hmm? Yeah. Let's see. Doctor, please. I'm addicted to eating bananas. Is eating bananas daily bad for the health? Ah, okay. Let me respond. Please, if you have no medical problem, let's now talk something. If you don't get any medical problem, eat your banana in moderation. Fine. But if you get some medical condition, you get some people we get heart problem, you get some people we get kidney problem. In as much as we tell them to eat fruits, because we dey monitor some things for their body, and e get some of all these fruits, some kind things dey inside wey dem get, some kind of electrolyte, example potassium. E get how you fit go chop am if you get problem. These things too fit give you another problem for those wey get issues. But if you have no medical problem, you are fine. Eat your fruits in moderation and you are good to go. It's like asking me, should I drink water every day? Can you feel stay one day without drinking water? No. So now my answer be that. Hmm? Uh-huh.
You are good to go.
Yeah, so you are good to go. Any more question? No more question for us on the topic. Okay. Can we do a brief recap for Israel as we prepare to round up? But before we do that, no forget, if you want to sponsor this program don't they run since 2020. 2020, 2021, 2022, 2023, 2024. And this program they run every Sunday. By the grace of God, we dey here. So if you want sponsor this program or you want put adverts, send email. See the email for your screen. Send and come. Now so. Dr. Israel, let's do a brief recap as we prepare to round up.
Okay, a brief recap from where we start with. First of all, define what the immune system be, and we say immune system na those system or those part of our body when they help us fight against disease or fight against anything when the body see as foreigner for our body. And we say most of the immune system are white blood cells. So and then they pass through all the body to check the body to make sure say the body dey in a good shape. I would say there are many immune system, there are many organs, many things when they form the immune system, and there are different type of immune system, but not be that one dey important. That the most important thing is that the immune system they protect us from disease, to protect us from harm. Then we can also look at things when we reduce the immune system, and the things we can divide them into three. We say our lifestyle, medications, and disease conditions. Under our lifestyle, we mention the first thing when we mention our stress, because we know say everywhere they stressful. And with the way we want to answer somebody question, stress will not go fit stop stress, but we go only feel reduce, we go feel reduce stress. So stress now one of them. Another thing when we mention are those when they smoke, when they drink, excessive drinking, then people when they eat junk food, excessive eating of junk food, and junk food job be their food all the day, and lack of sleep from any form. So these are our activity, our lifestyles when we cause low immune system. So when we talk about disease state, we say diabetes go fit cause low immune system, HIV go fit cause low immune system, so hereditary, some cancers go fit cause low immune system, some genetic problem for the body or autoimmune disorders. Yes, autoimmune disorders for the body go fit also cause low immune system. Case like lupus or rheumatoid arthritis. So some diseases of the blood can also cause a low immune system. Because for the medication, those person when they take steroid and when they take medication for the treatment of cancer, when they take medication to reduce the immune system because of transplant, organ transplant, any form of organ transplant. So all these are things, some of the things where it cause, because it's a malnutrition, and still part of things where it cause low immune system. So we also went further to mention some signs and symptoms, and we say these signs and symptoms are not specific. So even when you see them, it can mean something else, and it can also mean low immune system. And we said people when they fall sick all the time, fever wey suppose last for 3 days, your own don dey go 1 week, 2 weeks, it can just be due to low immune system. You dey always dey tired, any small thing you are tired, you sleep wake up you are tired, you dey waka you are tired, anything you do you are tired, it's also a sign of low immune system. Now you dey always dey get common cold, is also a form of low immune system. You injure yourself, the injury not green heal, and you get some stomach problem, like you dey purge and all that. All those are signs of low immune system. So we went further to talk about what person fit do when going improve the immune system. And we say when you eat balanced diet, food that contain a lot of vegetable, your fruits, and you take a lot of water, those things go fit help you reduce your improve your immune system. And we constantly say for the lifestyle, when you change, you modify your lifestyle, those things we mention for the lifestyle, like smoking, drinking, if you reduce them or you stop them, lack of sleep, you try to sleep, and stress. And we mentioned some few ways to reduce stress. A simple taking of deep breaths can help to reduce stress. Exercise, taking a stroll, leaving some stressful assignment at that point and take a walk, having a recess in your workplace. So these things can actually help to reduce, to boost your immune system. So these are some of the things we'll talk. Then from there we answered questions, and I believe we were able to answer your question. If you give us question and we not answer, it's either two things. Either as I don't do recap, so I've answered your question, or your question not related to the topic of today, or your question carry make we prescribe drug for you, and we not dey prescribe medicine for this place. So another thing we consider say, even though we've mentioned all these things and for you to do, say there's also a room for medication. And we mentioned the medication, say they are called supplements. So they are called supplements because they are not to be used to replace your normal eating and your normal stuff. And these supplements should be given to you by a medical doctor. And the doctor will only give you this supplement. Most of the time, doctors will give you this supplement when they notice, say, wetin you dey take is not enough to boost your immune system. Maybe due to some disease state, or due to one thing or the other, when the doctors see, so they will give you this supplement. And there are so many supplements when the doctor take one or two out of it, and say, okay, you take this supplement, join your other food when you dey eat, so that it go boost your immune system. I'll make I let you know some supplements. Wetin some supplement dey do is not that now they go give you those immune system. Some of these supplements go make you go eat your natural food to get those immune system, those things that you really need in your body. So these are so many things we've talked about today on understanding low immune system.
Thank you so much, Dr. Israel. Chai, we don't answer your questions. We don't talk about low immune system. And I hope we were able to break them down for you to understand. And one more time again, I won't beg you, help us share this live session. The more you share, now so you take the support us. And if you know so you get any medical condition where we mentioned for here, I beg, speak with your doctor, make them check you. I can always tell you, good life now waiting. Good life. Now sense. So Israel, your final words as we go.
Okay, and my final words still remember wetin I talk the first time. For every information when you get, abeg try verify the information. Even the information when we dey give you now, verify them to see if these information are correct or they are wrong, so that make you not go dey carry wrong information for your head and use am take dey work or use am take dey do your daily activities. And so that if you fit do those, the world will be a better place for all of us. Thank you.
Yes, so if you do those ones, the world will be a better place for us. Please verify the things where you dey hear, because say something they internet no means say the thing they correct, because something they Google and then write something does not make it correct. You have to verify the things you listen to, the things you hear, so that make you know, give yourself unnecessary high blood pressure. Thank you for joining us. Thank you for always being here. We don't take it for granted, for spending your data, for sharing, for sending us gifts. Yes, the person that sent us 99 stars, your name is Orobosa. Thank you so much. We will see you again next week Sunday by the grace of God. Take care of yourself and have a wonderful week ahead. Bye-bye.